Welcome, everyone. I'm very happy for everyone who's been able to join us today to talk about what is a really critical theme for the Global Fund and all of us as we prepare for the 2023-2025 allocation period. My name is Matthew McGregor. I'm the Deputy Head of the Health Finance Department at the Global Fund, and I'm going to be one of the presenters for the session today. I'm also joined by a number of colleagues who work in the Health Finance Department at the Secretariat. And we're presenting this on behalf of the Secretariat overall, because many of the themes that we're going to discuss today, sustainability, transition, co-financing, value for money, innovative financing, cut across many of the themes that all of the Secretariat, our partnership, work on. So thrilled to be here today. Just before I get going, I just wanted to highlight that there's a ton of content we're going to talk about today. So we're going to pause in a number of cases, as Odd, I think, explained, to take your questions. Encourage you to use the chat. Let us know what you want to talk about. Let's make this as valuable for our audience as possible. We're also going to be switching between themes, and so we'll do our best to switch between themes and really make those transitions as easy as possible. So I'm going to get going. So before we start, just to talk a little bit about an overview, stepping back. I'm sure this comes to no surprise to many of the people listening on this, but there are a number of factors that are going to create a lot of pressure for the Global Fund in the countries we work with and the national HIV, TB, and malaria responses and health systems in 2023-2025. We know we have a highly ambitious strategy moving forward, where we need to see more investment from our allocations in things like RSSH, specific technical areas, prevention, in order to achieve our objectives. We also know countries are really facing unprecedented fiscal pressure. We've seen deprioritization of health spending in certain places. Economic growth is slowing in some places. We've seen challenges with inflation, currency devaluation. We also know that the Global Fund's allocations potentially could be more constrained in this next cycle, to a large extent because of the increasing cost of commodities, essential services, things that each of the countries we work with are really grappling with. And the reason I mention all of that is because it means that our efforts on domestic financing, sustainability, value for money, and innovative finance, all of the things that we're going to talk about today, are perhaps even more important than they ever have been. And that's also in the context of the fact that when we step back, we have to recognize that domestic financing and domestic resources matter enormously to the ability of the Global Fund to accomplish our mission. And you don't have to take my word for it. If you look at the Global Fund's investment case, while it recognizes the importance of the resources we have in allocations, 3 times more resources need to come from domestic financing. And so the way in which we can engage in domestic financing, the way in which we can encourage enhanced, better use of existing resources and more resources will be absolutely critical to our ability to meet our programmatic objectives. And that is why our new strategy has never been more clear that enhancing our focus on both raising additional resources and working closely with countries to strengthen resources available for health systems and national HIV, TB, and malaria responses, as well as maximizing the impact of existing resources, is such a prominent piece of the Global Fund's new strategy. And this touches upon many of the things that we're going to discuss in this session. It touches upon our approach to value for money, our approach to DRM and co-financing, our approach to innovative finance, our approach to health systems, strengthening health financing systems. And so as we look to 2023, 2025, our ability to deal with, grapple with, and hopefully advance our work in the areas that we're about to talk about will be really critical to achieving all of our objectives in this cycle. So to start, I want to spend the next few minutes talking about co-financing. This is a theme that I would imagine many of you know about, but I'm going to go through this in a way where we touch upon some of the basics and also get focused on some of the things that we would like to see collectively us focus on more for the 2023-2025 allocation cycle. So as a reminder to the group, co-financing is critical to the achievement of health outcomes. If you step back and think about the levers that the Global Fund has in order to influence domestic financing and health financing. Co-financing is one of the most prominent. While we have work on advocacy and we support countries on technical issues, and while we try to leverage our partnerships, our ability to use our grants to open an important conversation at the national level about how countries are improving their financing of the national responses is critical. So co-financing really has multiple purposes. It's a critical advocacy tool. It's an incentive we can use to try to strengthen DRM, domestic resource mobilization, and improve domestic financing. It's an incentive we can use to push and work with countries to pick up specific interventions that are predominantly financed by the Global Fund. It's an entry point with many national stakeholders who we need to engage on domestic financing, including the Ministry of Finance. And it's a lever that we can use to really strengthen and try to improve country ownership and national ownership of the national responses. I'm going to step back and talk a little bit about what our co-financing policy tries to achieve. I imagine most of the folks on this call, it's not the first time you're hearing about it, but I think it's good to remind ourselves of what our co-financing policy is all about. So the first thing is that we want to see through our co-financing policy more domestic financing for health overall, greater health prioritization, particularly in low-income countries. Where we allow for full flexibility for countries to make commitments to strengthening resilient and sustainable systems for health. We also want to see, number two, more domestic spending on national HIV, TB, and malaria responses. And number three, using the co-financing policy, we want to see more absorption or uptake of specific costs financed by the Global Fund. If you look across our portfolio, you're going to see challenges on each of these three levels, whether it's low health prioritization overall, whether it's massive or big funding gaps for the national responses, or whether it's for specific interventions, whether it's ARVs, HRH, human resources for health, key and vulnerable population programming. You still see a strong reliance on Global Fund financing or other external financing to finance interventions that we know are critical to impact. And so our co-financing policy tries to address those three challenges at the same time. We've seen good trends over time. Countries have increasingly been improving and strengthening their domestic financing, particularly since we as a Global Fund have instituted our co-financing policy. So don't get me wrong, because I'm about to spend the next couple minutes talking about some of the challenges that we see. And the reason I'm doing that is because we know that co-financing is going to get even harder in this next cycle. While I talked at the beginning about how it's likely to be even more important, we also know countries are facing massive fiscal challenges. And so our ability to implement the policy even better than we have is going to be critical. So what are some of the challenges that we've faced? One of the first ones is data challenges and inconsistencies in co-financing documentation. When we look at the information that we've received from countries about what they're financing, what they're committing to, we often see either lack of quality of that information or inconsistencies in the documentation, where we receive from one source information about certain financing trends and another source information that would contradict that. So we have some data challenges that we have to grapple with. In some places, we haven't seen enough linkages between the financial commitments we're receiving and the programmatic outcomes. We know that co-financing and financing overall is a means to an end. We want to use it to strengthen the programmatic objectives. But there's been places where we've seen financial commitments that don't necessarily address the most difficult programmatic challenges that countries are facing. And so looking at how we can strengthen that linkage is a key priority. I mentioned before that one of the challenges we still see is lots of reliance on the Global Fund for critical interventions. This depends heavily on country context, and it's not the same depending on which part of the portfolio we're talking about. But we know, for example, that in certain parts of the portfolio, while our HIV objectives are going to require more investment in prevention, a lot of that investment still comes from the Global Fund. We've seen minimum investment in some places in community system strengthening, which is upfront and one of the most important pieces of our new strategy. We know that there are still situations where we have highly commoditized grants and a reliance on the Global Fund for even first line or second line treatment. And so figuring out how we can use the co-financing policy and work with countries to address some of those dependencies is critical. Another problem we've seen is too little focus on efficiency. While the Global Fund is continuing to encourage additional resources, we also have to recognize that when countries are more efficient with resources that currently exist, whether it's a reduction in prices of commodities, or whether it's new service delivery models that would improve efficiencies in existing spending, we need to find ways to reward this with our co-financing policy. And so moving forward, we'll see a big focus on using it to enhance efficiency. And then finally, we've seen places where we don't see as much country accountability. Depending on how you've been working with national stakeholders, you might have heard confusion from them around which commitments have been made to countries, by countries, whether or not those commitments are shared with all stakeholders, how all members of CCMs and government understand and commit to those. And so we want to see a big focus on how we can strengthen accountability moving forward. And then the final one I won't touch on now because I'll get to it. And so if we look at those challenges, we are really thinking about for this next cycle, what can we do about them? How can we try to address some of them? And I think there's three major themes that we want to be thinking about together. One is encouraging greater ownership and accountability of the governments that are making these commitments. Now, I don't say that because I think that governments aren't making commitments. In fact, governments are financing largely national responses. But we're going to need to see even greater accountability if we're going to achieve those objectives. The second is something for the Secretariat. We've often pushed to make quite complex commitments that might be hard to understand. And we might need to be thinking about how less might be more. Less, but more strategic commitments that aren't across many different objectives, but really focus on where it matters most. And then the third is really around systematically, how do we improve the data we have on domestic financing and commitments, as well as the ability to track those commitments over time. And so when you think about these three high-level focus areas, this slide highlights a number of the things that we really want to focus on as we think about the 2023-2025 cycle. The first is around programmatic objectives. As I mentioned before, co-financing is really a means to an end. So how well our financial commitments link to the programmatic objectives we want to see is quite critical. The second would be making sure we're clear that it's the total commitments that matter. We have heard directly from countries that there is often some confusion around the co-financing policies focus on additional, right? But of course, what matters is not the additional commitments, but it's how we're using the entire resource envelope to be able to fund the programming that we need to fund. And so really making sure that when we're thinking about co-financing, we're thinking about the total, not just the additional or incremental amount will be critical. I mentioned before, but we've seen situations where there's too many granular commitments across many different thematic areas, making it hard for the Global Fund to track, making it hard for countries to advocate around. And so looking at the most strategic commitments with a focus on less and more will be important. The next one will be focusing on measurable commitments. There have been quite a few times where we've grappled with commitments that are really hard to understand how they're being implemented. And this is critical for all. It's hard because it makes it difficult for the Global Fund to track. It's hard because country level stakeholders aren't often clear on whether they're being realized or implemented. And so really thinking on how we can negotiate and agree on measurable commitments will be critical for the next cycle. And then the last two, really focusing on agreeing data sources and reporting upfront, and where we see commitments that are linked to health products, which is one of the biggest focus areas for co-financing commitments, making sure we're not only looking at the financial commitments that go toward health products, but also looking at the procurement capacity and the ability overall of countries to come through with those commitments, to upfront address the risks we've seen of stockouts in a number of different places. So what are we doing in order to support some of those changes. And how is that going to link to the next cycle? And this is where I'll stop. The first is that you'll notice when you start applying for global fund financing in this cycle that we've adjusted the funding request narrative. You'll see new questions that are designed to try to get more clarity on the co-financing commitments that countries are submitting. The second thing is that countries will be asked moving forward to submit a mandatory commitment letter. We don't think that this is actually going to be that challenging because most countries submit as part of our processes commitment letters. But really focusing on the quality of those commitment letters, making sure that they're discussed, robustly owned by all stakeholders at the national level would be key. We've updated the funding landscape table so that we can try to have more clear information moving forward in this cycle. If any of you on the call are supporting CCMs or PRs as we put together funding requests and grants, you'll notice that the new tool we have, the new funding landscape table, is more granular, asks for more clarity and sources in different places. And we didn't do that to try to add burden on countries so much as that information is critical to understanding the domestic financing situation. We're also working on more nuanced approaches on how we set co-financing incentives and negotiate countries. And that's a clear reflection of the fiscal challenges we know countries face. And then finally, both at the Global Fund side, but something that we know we will be discussing with CCMs and countries moving forward, really looking at how we can focus on the risks associated with non-realization of commitments. We know that we're in a moment of pretty significant financial difficulties where countries are grappling with many different challenges on the financing front. And so when we're thinking about negotiating strong commitments, we also have to be thinking about what are the risks to realization and how do we mitigate those risks jointly with countries. So I'm going to pause there and check to see if we have questions that came in on co-financing. Let me pause. I see one that's come in from Gemma already. Hello, Gemma, and welcome. But let's see if we have more that come through. So what I'll do, if it's okay with you, Odd, I'm going to start speaking to some of these, and we'll really encourage my colleagues to come in as needed to support. Since I'm go ahead.
Question for you, Matt. Sorry for not bringing this up earlier, but as you go through, just to make sure that everything is being translated into the other languages, if you could read at least the critical part of the question aloud, and that will make it interpreted. Thank you.
Perfect. So the first question is anonymous. In previous cycles, the co-financing letter was a required annex at the time of funding submission. For 2023-2025, I recall hearing that co-financing letter is now only due during grant making. Am I understanding this key process change? If so, what kind of co-financing discussion should be had? It's a fantastic question. So whoever asked it, thank you so much. Co-financing commitment letters were actually not mandatory in the past. Whoever's asking the question, it probably was mandatory for the countries you were working on. But we've actually seen different types of commitment letters across the portfolio overall. So in this cycle, they're 100% mandatory. We see them as really critical to being documents that are endorsed by country budget holders and that lay out specifically the commitments. And to answer the question specifically, we are recommending that they are submitted in line with the funding request or at the time of the funding request. But at the same time, we want to be a little bit flexible. We know countries deal with lots of challenges during funding request development. And so if it's not possible, they are absolutely mandatory to be submitted during grant implementation, or sorry, prior to the approval of the grant. But we really would recommend that this becomes a fundamental focus of country dialogue as early as possible, and that if possible, along with the funding request, those commitment letters that are really one of the most important instruments to outline the commitments countries are making are submitted at the time of the funding. I hope that helps. The second question is really around something I probably went too fast on, so thank you so much for asking it, around the challenges that could come about when we see purchasing of commodities and really strong commitments to our co-financing commitments around health product procurement. So first, let's just say we know a lot of commitments come in around health products, and there's a reason for this. It's not necessarily because the Global Fund pushes for this. It has a lot to do with a significant amount of our allocation is focused on health products. And so when we're thinking about how we can invest that allocation in new interventions, new focus areas, it's pretty natural that there needs to be a discussion around whether or not countries can take these on. I think the question is getting into the heart of something I mentioned, which is that if we go too fast when it comes to co-financing on commodities, if procurement systems are not where they need to be, and if we phase health product procurement over too quickly through co-financing, we can have challenges. And in parts of the portfolio, we have seen stockouts. We have seen quality control issues. And so my recommendation around this is that if there is going to be a discussion in country dialogue about making commitments, co-financing commitments that relate to health products, we should be discussing, as the slide referenced, not just the financial ability of countries to make those commitments, but also the ability of countries to procure quality health products at good, affordable prices, and the systems that are in place to working on those. And often where we've seen these commitments function the best is when there's a real phasing to them, right? Not a drastic pendulum swing between one year and another, but really a phased, planned commitment over time to pick them up. The third question, and I'm going quickly, but we've got a lot to cover here today, but these are great questions. Is the new financing gap table available? Yes, it's available, and it's on our website. So for those of you who might be supporting CCMs or CCMs yourselves, would really encourage you to download it to see the changes that we've made. It could be a complicated document. So you'll notice that in the actual funding landscape table, there's recommendations of who to reach out to if you have questions. And I would really encourage all of you who are working with country teams, if you have questions on that FLT, reach out to your country team and ask them to connect with your health finance specialist. We've got quite a few health finance specialists now at the Secretariat who really do want to proactively work with countries on the FLT, or the financing gap table, the funding landscape table. What counts toward in-kind contributions as part of a match fund from a CSO perspective? I'm going to have to ask if someone can give me a little bit more detail on that question, because I'm not sure I understand it. If we're talking about matching funds at the Global Fund, which is a pretty specific modality, matching funds actually match against the allocation. So if countries invest more of their allocation, they can access more matching funds for that specific intervention. But perhaps what I would ask the person who asked this, if someone can put in a little bit more detail on what they mean by this, and we will go from there. Do we have more questions coming in, David, or should we?
No, I think we have one more question coming in. Yes.
So I'm
yes.
seeing a question around in the chat around donations being considered. I'll have to ask. So first, let me say that we have a definition of what we accept in terms of co-financing in our operational policy note on co-financing, which we're updating, but is available to applicants, where we talk specifically about what we mean by co-finance. I'm not sure, we'll have to maybe get into it at the end around donations, because co-financing is government contributions. And so usually say if governments are donating, in quotes, health products, they're procuring these. So that would be listed as a procurement of health products, not necessarily an in-kind contribution. The way that our co-financing policy really works is we want to see domestic investments ideally incorporated into budgets on an annual basis. So let's maybe take that question and see if I can work in the chat at the end and see if I can get a little more specific on it. Yes, okay. So let me take this last question before we head into the next session, because I am paying attention to time. It's an excellent question, and it's challenging. So thanks, Noura, and I'm sorry if I pronounced it incorrectly. The question is focused around we encourage the commitment to be done during grant development, but in many cases this could be too late, because we have to have the government to commit during the period of the grant, and it might be challenging for the government to do that because of, say, budget cycles or planning processes at the national level. It's a real challenge, and what we try to do is that because we have our 3-year funding cycle, first, we try to be a little bit flexible about when the final commitments or are presented to the Global Fund. So we have had cases where countries have explained that while they can make indicative commitments, they need to wait for a budget cycle to start again to make sure that those commitments are actually realized into government budgets. One of the things, though, where we've seen lots of success on this is not to think about co-financing as a one-cycle thing, but to think about co-financing as a gradual uptake of costs associated with countries' strategic plans. So that rather than thinking about the Global Fund as providing a grant and therefore we need to negotiate co-financing, stepping back and thinking, here's all of the costs in a national strategic plan, and over time, are we working on picking up the costs of those strategic plans and the national responses? Because it is a real challenge. If we were to work with countries tomorrow to offer additional funding, it would be unrealistic for us to think that that additional funding could be matched immediately by government financing. That's not how PFM systems work. And so we've tried to be as flexible as possible. Where flexibilities are needed, we can often extend timelines to deal with these things. But I think that the actual solution we've seen is really early engagement around this. We are releasing allocation letters soon, and discussions about co-financing and what commitments will be made should start immediately, because for the very good point that Noura is making, that it's not easy to wait until the end and then ask for these things to be picked up in government budget. And Noura, I'm not sure if that answered your question, but I'm happy to go a little bit more in depth in it. But I'm also looking a little bit at the clock. So what I'd suggest, David and Aude, is this: why don't we move to the next session? Would encourage people to continue to ask questions on co-financing in the chat. We'll log those and then we'll come back to them at the end. Would that be an okay approach?
Yes, exactly. That's what we're gonna do.
All right, fantastic. And then for my colleagues who are online, if any of you want to offer any thoughts in the chat as I continue to present, please do so. So we're going to make our first shift in focus. While co-financing is obviously linked to broader questions of sustainability, transition, I want to spend a few minutes talking about the Global Fund's approach to sustainability and transition, because it's still going to be just as important in this upcoming cycle. So for those of you who have worked with the Global Fund for a while, I'm assuming that that's the vast majority of people on this call, this topic won't be new to you. Back in 2016, the Global Fund's board passed what we call our Sustainability, Transition, and Co-Financing Policy. And really what that policy was a commitment to partner with countries to more proactively strengthen sustainability of the national responses and health systems and prepare for transition away from Global Fund financing. When the policy was passed and when the Global Fund launched more efforts on this, it was based on a real recognition that this is hard, this is challenging. If you look across the development sector as a whole, we see real challenges in sustaining investments that are often provided with external financing. And in the Global Fund context, we saw real challenges, particularly in Eastern Europe, where the Global Fund had moved away from financing countries, and we saw resurgence of incidents. We saw some of the really strong programs related to prevention or reaching key and vulnerable populations have challenges being sustained. And so the policy and the overall approach that the Global Fund put in place was really a reflection that in order to address these tricky issues, we're going to have to work much more closely and proactively with countries. This is not necessarily a new thing for this strategy. So in many ways, it's continuing from our previous strategy. And there's a number of focus areas in addition to co-financing, which I just talked about, that are covered by the policy. One of the first ones is a need to focus on sustainability across the whole portfolio. Often when the Global Fund talks about sustainability and transition, people tend to think about it as only for those few portfolios where the Global Fund might be transitioning away. But the truth is that the earlier we can work on sustainability, the earlier we can start to have a conversation about the long-term challenges, the easier they're to address. So there's a big focus in the policy on long-term thinking about sustainability. There's also a major focus on working closely with countries to advance planning. It might sound trite or cliche, but we've actually seen that where there is a robust national conversation about sustainability, there's much more of a likelihood to be addressing some of these challenges. There's a huge focus on making strategic investments to strengthen health systems and RSSH. That's natural. Health systems and strong health systems really underpin the national responses. So when we're talking about long-term sustainability, we have to focus on them. And then finally, the policy puts a huge focus on attention to key and vulnerable population, human rights, and gender. And one of the reasons it does is because we've seen real challenges in sustaining national responses around issues of KVPs, human rights, gender, and they're critical to programmatic impact. So just stepping back a little bit, what do we mean by sustainability and transition in the Global Fund context? I won't spend too much time on this, but I do want to highlight that when we think about sustainability, and these are the definitions that we use for it, we're not focusing on sustaining one individual program or one individual intervention. The policy and the definition is really around maintaining and scaling up coverage overall in order to address the epidemiological challenges that we know exist. And I say that because often when we're talking about sustaining responses, it's not just about sustaining a program or an intervention. There are real questions of integration, health system transformation that have to be taken into account. But keeping our focus on how do we sustain access and coverage to services, both with Global Fund financing and without Global Fund financing. And transition is really the process by which a country working with the Global Fund over time moves away from receiving financing from the Global Fund. So I think one of the best ways to think about this is the image that you have at the bottom of the slide. If we think of that image as the Global Fund's portfolio, with low-income countries on the left and upper middle income countries on the right, given that the Global Fund funds almost 100 countries across the globe, our focus on sustainability transition matters to all of those contexts. It matters to low-income contexts, it matters to lower middle-income contexts, it matters to upper middle-income contexts. But what we ask of countries is very different. In low-income contexts and lower middle-income contexts with big burdens, where we have most of our funding, this is really we need to focus on long-term sustainability. And as we move to lower middle-income countries with lower burdens, where we've seen allocation reductions, this is where we really need to start having a conversation about transition. And then finally, there is a small set of our portfolio that is transitioning or moving away from Global Fund financing, where we try to support with a transition grant to make sure that there's no abrupt ending of Global Fund financing. Now, it's always hard to talk about sustainability because the word means so much. In the guidance that the Global Fund has developed, we've highlighted quite a few considerations that we think are important for countries to take into account, but with a big caveat. This will be heavily focused on country context, on the various health systems and financing challenges that countries are facing. But in our guidance, which will be available by the end of 2022, the Sustainability Transition and Guidance Note, we try to highlight a number of considerations based on the types of challenges we've seen. So one is around strengthening national planning. As I mentioned before, where we've seen robust, strong discussions at the country level aligned with broader health system strategies, national strategic plans, we've seen more of an ability for countries to be able to deal with some of the tricky sustainability issues. The second is the entire work stream around improving health financing and domestic resource mobilization, which I spoke about. The third is really thinking about how we can improve our alignment with national systems. In many places, the Global Fund is quite good at financing on plan, really making sure that our financing is aligned with the strategies of countries. But we're not as good when it comes to financing on budget and making sure our financing runs through national systems. And this is an important thing to be thinking about. Now, will it look the same in every country? Of course not, but it's an important theme to be grappling with. Again, finding ways to make strategic investments in health systems and RSSH, either through Global Fund allocations or domestic financing. Maintaining and strengthening access to affordable and quality health products. This has been a key sustainability challenge, and there is guidance around ways to address it. My colleague Shufang will talk about our approach to strengthening value for money. And then finally, really looking at strategies for addressing human rights and gender-related barriers and strengthening health governance, thinking about the role of the CCM in addressing sustainability challenges vis-a-vis the broader governance system at the national level. So those are some of the challenges, the things that we've highlighted, and they matter to the entire portfolio. We've also highlighted in our guidance specific considerations that might matter a bit more to all those portfolios who are closer to transition. For purposes of time, I'm not going to go through all of them. But if you're working with a country in the lower middle income context or an upper middle income context, would really encourage you to look at some of the guidance we have in the Sustainability Transition and Co-Financing Guidance Note, where we highlight some of these. And these are things like accelerated co-financing of all interventions. While we encourage co-financing across the board, when we get to a context where we're moving away from countries, reducing allocations, we need to see more accelerated co-financing of all interventions. Either that or integration of those interventions as part of broader health system transformation and strengthening. We need to see more of a focus on sustainability of interventions for key and vulnerable populations. Again, while this matters everywhere, we've seen really serious challenges in transition contexts of maintaining access to key and vulnerable populations. And often achieving any of the programmatic objectives, particularly in HIV, but not exclusively, requires much more of a focus on working with and reaching those populations that are the most affected by the epidemics. And so there's a whole series of transition considerations that we've outlined as well. So before I stop and turn it to my colleague Shufang, I just wanted to reflect briefly on what do we ask of countries on this topic in the funding requests. And I highlight this specifically because given how complex of a topic it is, we do not ask countries to comment on specific areas. What we say is that we really want countries to describe what they believe are the most important sustainability challenges they're facing, thinking about this across all of the dimensions of sustainability, financial, programmatic, systems, epidemiological, and what countries are doing either with the support of the Global Fund or partners or through national initiatives to address them. Again, this really depends on country context. In some places, it might be about broader health system transformation. In some places, it might be about financing for specific interventions that are heavily financed by the Global Fund. In some places, it might be about modifying service delivery modalities. But really where we need to focus and get better in 2023, 2025 is how well we identify those sustainability challenges and then how well we're working together to slowly address them as we move into the next funding cycle. So we're going to pause for questions in a second. But before we do that, I want to turn to my colleague Shufang to talk a little bit about value for money. And then we'll pause and reflect together on both the broader themes of sustainability and transition and value for money. So as Shufang is speaking, if you have questions about our approach to sustainability and transition, please put them in the chat. Shufang, are you with us? And can I pass over to you?
Yes, Matt, can you hear me?
Perfectly.
Okay, great. Hello, colleagues. Welcome to this webinar. My name is Shufang Zhang. I'm the Senior Advisor on Value for Money, coordinating Global Fund effort on Value for Money. Thanks for the opportunity for me to brief you on our effort on VFM. Given the significant financial distress that the world is facing today, spending well becomes even more critical than ever. And in this section, I will focus on providing a high-level review of Global Fund's updated Value for Money technical brief, aimed to assist countries to better approach value for money. This technical brief represents a joint effort across the Global Fund Secretariat, incorporating comments and advice from technical partners and Global Fund technical review panel. I will first review our updated value for money framework and highlight some key elements of the efficiency dimension of value for money, and then finishing by offering a few high-level messages on what are expected for the value for money within the upcoming funding request. So value for money is a concept to maximize and sustain equitable quality health output, outcome, and impact for the level of resource available. Global Fund's value for money framework is composed of 5 distinct but very much interlinked sub-dimensions throughout the health production chain, from inputs through processes to results. Each dimension has 3 sub-areas. Next, please. The first dimension is really around economy on inputs. It calls for effort to ensure right prices for the right input. This includes not only the health products, but also human resources, travel-related costs, trainings, and professional service fees, etc. It requires an optimal, appropriate level of management costs, which has been repeatedly flagged by the TRP members for the Global Fund and our PRs to improve upon. It also calls for robust procurement and financial management systems to ensure that all inputs are procured through transparent, competitive, accountable procedures with fiduciary risk being minimized. Next, please. The second dimension is effectiveness in achieving results. It is, in addition to focusing on effectiveness in reducing the disease burden, there are 2 additional dimensions we would like to highlight, which includes effectively addressing human rights, gender-related and other structural barriers, as well as effectiveness in strengthening our health and community systems to enable the ultimate elimination of the 3 diseases. Next, the third dimension, which links the input with the result, is efficiency, for which I will elaborate a bit more in the next slide. Next, the fourth and the fifth dimension are equity and sustainability, which are cut across the entire health production chain. Obtaining equity implies invest fairly and achieving programmatically leaving no one behind, and ultimately making sure the equitable health outcomes are obtained for those most marginalized. Achieving sustainability implies to ensure program and system level investment are made in a way to provide and finance services that are efficient, affordable, programmatically feasible to maintain and scale in the longer term. It also calls for meaningful domestic investment to fund high priority health needs and key health system functions, targeting the important goods and services that are essential to continue, expand, and sustain key interventions, reducing countries' dependency on external resources. Last but not least, successful transition. So overall, the VFM must be considered through the totality of all 5 dimensions, and they cannot be approached independently or in isolation. More details on the expectation of different sub-areas of value for money can be found in the updated value for money technical brief, which is now available online, including key opportunities to enhancing value for money along the global fund grant cycle, as well as some typical balances across VFM dimensions to be carefully made. The guiding questions on value for money sub-areas and the country examples on VFM effort can be found in the annex of the technical brief. The full technical brief are being translated into French and Spanish, will be made available online shortly. Next, please. Now let's zoom in on efficiency, which is an important value for money dimension linking to all other VFM elements, as Matt alluded earlier. Efficiency is to transform input in a way that maximizes the output or results. There are 3 types of efficiencies we're looking for. The first is allocated efficiency. It implies to allocate resources strategically across interventions, populations, and geography to maximize impact. Or in other words, it is to invest the right intervention mix at the right places for the right population groups. This applies to both program-specific interventions as well as health system level investment. The second is technical efficiency, which focuses on for a given intervention and then the investment in a way that the cost of quality health output is being minimized. For example, how to best efficiently deliver female sex workers prevention programs or net campaigns or MDR treatment, and how to best invest for system level effort, such as human resources or lab systems. More specifically, at the program level, technical efficiency can be achieved through choosing more efficient service delivery modalities or platforms. For example, moving hospital-based care to outpatient services as appropriate, expanding active index testing and contact tracing, or conducting trainings online versus in person as appropriate, and promoting community-led service delivery. Technical efficiency can also be achieved by carefully choosing the right inputs and the right quantity needed for service delivery. For example, introduction of new technologies informed by cost effectiveness of this new technology, and proper task shifting to reducing the service-related delivery costs, and a solid quantification to minimize wastage due to drug expiration, as well as robust planning of the number of GeneX machines to be either purchased or contracted for service delivery. At a system level, technical efficiency can be achieved through removing duplications and improving integration across health system and delivery platforms. The third type of efficiency is grant management efficiency. This would require sound implementation arrangements, governance and management systems, so that we can achieve high absorption and generate efficiency gains, and also mitigate any programmatic risks or bottlenecks along the grant implementation processes. So the 3 types of efficiency would need to be approached holistically in the funding requests. Next, there are different tools and analysis that can be used to support countries to improve investment efficiency. Some of those tools are provided in the Annex 3 of the Value for Money technical brief. They could support countries, for example, in intervention prioritization through allocated efficiency impact modeling, or choosing the more efficient service delivery modalities through cost effectiveness of comparing different service delivery modality options. It can help countries to place optimally the community health workers and lab equipment and best improve service referral network informed by geospatial mapping of service accessibility, programmatic gaps, and also to map them against the disease burden subnationally. So last but not least, those type of analysis can also helping country to enhancing system level efficiency through diagnosis of duplication of the health system building blocks. If colleagues have any questions on those analysis, please feel free to reach our team as we support some of those analyses funded through Global Fund Sustainability Transition Efficiency Strategic Initiative in close collaboration with our technical and funding partners. Next, please. To end, I would like just to highlight a few take-home messages on VFM. As you know, VFM is one of the TRP's review criteria and is an important area that TRP has been very supportive and interested in us to promoting. Global Fund VFM key messages are harmonized and standardized across our application materials and guiding document. It is a concept that to be strengthened from the grant design to operation throughout the Global Fund grant cycle. Unlike the NFM3, there is no specific question on value for money nor efficiency in application forms for NFM4. However, we are expecting countries' effort on FM, including that on efficiency, can be well articulated cohesively throughout the application forms. Key elements of FM is being articulated in multiple places, as shown in the table on the right, which maps of FM dimensions over the full review application form as an example. On efficiency in particular, special focus is expected around the prioritization of both program and system level investment for greatest impact, ideally with a clear focus on geographic prioritization. Strategic choice of platforms, modalities, and input for efficient service delivery through the lens of people-centeredness and integration, and lean yet effective implementation arrangement. Applicants are really strongly encouraged to provide better data and strong evidence to really rationalize the ask, including for resource allocation, which underpinning the program design, as well as the resource allocation plans through the implementation of the program. They are also really very much encouraged to well articulate the overall VFM effort, including how VFM dimensions are well balanced given the country settings and through inclusive but evidence-based country dialogue. For example, in certain settings, applicants need to be explicit how the need to enhance both efficiency and equity are well balanced, and how short-term impact versus long-term result, as well as quick programmatic performance versus long-term sustainability are well balanced. So in summary, achieving value for money is in the hands of all of us. It is a shared responsibility and an effort to be jointly made among development partners, the governments, CCMs, implementing partners we work with, as well as the communities we serve. We look forward very much working closely to promote VFM without any hesitation and with a big effort. Thank you very much.
Thank you so much, Shufang. So we're going to pause. I'm seeing some great questions come in the chat. We're going to pause again for questions on anything. I know that these are big topics that cut across many different themes. So we're going to pause now for some questions. Perhaps I'm going to give my colleague Shufang a moment to read them before she has to dive in. And I will go back and take just 10 seconds to answer Winfred's question, because I don't think I got to it. Winfred, I think you might be referring to a more specific type of co-financing rather than the broader co-financing policy that we have when you're referring to in-kind. So I suggest we take that one offline, because I appreciate your follow-up, but I still haven't understood. I think it might be related to a specific thing. There was a good question just to finish, and then I'm going to come to you, Shufang. I think from Roger about whether or not there's going to be any fundamental changes in the proportion of co-financing and whether those will increase. It's a great question, Roger. And the answer is that no, there have been no policy changes for this coming cycle. In fact, I actually think it's a little bit different. We obviously want countries to make very ambitious commitments to their national responses, but we also want them to make realistic commitments. We want them to make commitments that have a strong likelihood that they will be realized and implemented. So we have not asked for more so much as to ask for better, more quality, more focus on the things I mentioned before. So while we know there's funding gaps, while we know that there's challenges, while we know we have to continue to raise additional resources, we also want to be quite cautious in a time of fiscal challenges to ask for too much. And so we've stuck with the basic parameters of the policy and really do want to focus on not just the how much, but the what and the quality as we look at this cycle. So let me then turn it to you, Shufang. We're running a little bit late and we have two themes, so I think we'll take about 5 to 7 minutes. But Shufang, do you want to offer some thoughts on, I think let's leave the first one because it's on its timeline. I'm going to ask our access to funding colleagues to see if they could take that one. But maybe a couple of the other ones. Do you want to make a comment on the Awa or Gemma comment? I can comment on 3 too if you would like.
Thank you, colleagues. Very good questions. Yes, I'm going to review on the screen, and I may miss some. If I miss, I'll follow up offline. Thank you. Yes, and the colleagues a very good point are made. Just to see that value for money or efficiency is not about cutting the cost. It's really about how do we optimize using the resources to improve on quality health result. We definitely disencourage for the sake of efficiency, reducing the cost, cutting the corners, we're not delivering quality services. Just rest assured, would be very important to think about the quality of service delivery, especially long-term consequences or the impact of delivering quality result and programmatically. And then in the funding request, I think it would be good if the applicants can actually demonstrate the way how resources being allocated or utilized to achieve better result, which with quality incorporated. I think we are not looking for lower cost. It's looking for the rationale, the thought process, and also different options the applicants has been considered to how can I say, to rationalize why they want to deliver service again a given way. Even if the quality will be increased, but if the quality is improving, that is a very good thing. Just make sure those are articulated well in the funding request. So that's question 2. Yes, and then question from Gemma, it is, thank you. Thank you for watching very carefully the Global Fund Value for Technical Brief. Yes, the grant management efficiency is a new area we're focusing in addition to allocating technical efficiency. And we very much encouraging countries to think about innovative ways of service delivery through improved grant management that would ultimately transform our investment to better and then bigger results.
Shufang, let's go to the next slide for you.
Okay.
Since you probably haven't seen them, let me just make one comment. Gemma, it's a great comment and question about dual track financing. We obviously are continuing to encourage CCMs and countries to think about not just government implementers, but also community and civil society implementers. As a matter of fact, the strategy is much more prominent about community system strengthening and the role of communities. And that's the right thing, because we need more focus on communities, civil society, and the implementation, because as you said, they're often the best at reaching the populations. I do want to mention one comment here though, and I'd love for the group to reflect on it. Especially when we think about sustainability, we need to be thinking about not just finding ways to have more community and civil society implementation, but we need to be thinking about the implementation arrangements around how that's done. Because we have seen some real challenges, even where we have strong community system financing and communities providing services. If that funding does not flow through governments, if that funding does not increasingly flow through governments, we see real sustainability challenges. And so I think as we work and really grapple with this tricky issue, we should be thinking about what our goal is. And our goal, I think, has to be sustainable financing of community systems. And what that means, I think, long-term is not only thinking about how we get more money out of our allocations to community systems and community implementers, but also how we get more domestic financing and how we build those relationships between governments and communities. So I just did want to comment on that. Shufang, there's a few more questions for you.
Yeah.
And then after we go through these, perhaps we'll move to the next section and keep going.
Yeah, I will be fast about the question from Roger. And just to say, yes, we were hoping actually more and more potential grant funds are being spent to building the data system, especially correlating or improving the availability and quality of financial data, including cost information or resource tracking, to enable us to conduct more efficient analysis. Yes, if that can be the case, will be great. In the new RSSH module in particular, we had made areas, especially for countries' grant, to be invested in strengthening those critical financial data systems. And then, of course, in addition, as I mentioned, we also have some resources to support countries' costing effort and also allocated efficiency analysis or cost-effective analysis to inform the development of NSPs. And if you are interested, you can get in touch with us to look into the countries being receiving such support in coordination with partners. And a colleague's question about efficiency across three diseases, the RSSH, is very, very important. As I mentioned earlier in the slides, when we're looking into allocative and technical efficiency, we have also a big focus around the allocative efficiency or technical efficiency across diseases, and then emphasizing very much the importance of integrated planning or in the rationalized investment of labs, human resources, supply chain information system, etc., which cut across different diseases. That's a very important area to focus upon. And we do have effort to supporting countries to quantify the efficiency gains through the integration, as contrasting in the previously siloed service delivery approach. And this is very much aligned with our new strategy of people-centered integrated quality service delivery. Yes, that's very, very important for that. And then last, what is Global Fund position on One Health approach? And we're very much supportive of One Health approach. And then the integration and the health system strengthening is a clear example. How do we want to work on that, especially in the context of the UHC agenda? And we also very much supported multi-sectoral approach, either for TB or HIV. We very much believe in addressing the social determinants of health. That's why you can see much more prominent featuring of the equity and human rights related issues in our approach, and also promoting effort for community-led and driven service delivery. Yes, we're very, very behind this One Health approach.
Thank you so much, Shufang. Just because I'm looking at the clock, I wanna go. We might be missing a question. I want to move to the next section. We might be missing a question here or there. So if we are, we'll try to come back to any questions that we've missed right at the end. But thank you so much, Shufang. And Shufang, if there's any you've missed in the chat, perhaps you could address some of them there as well. And colleagues, please continue. These are great questions coming in that really enrich the discussion. So I want to do our final transition of the day and of the session to talk a little bit about a topic that's quite different, which is around both innovative finance first, and then strengthening investments in health systems, in health financing systems second. I know that this is a relatively big switch to go from talking about sustainability transition, co-financing, VFM, to innovative finance, but this is a quite prominent piece of our work as well. So to step back a second, when I talk about innovative finance, our global fund strategy is clear that we need to be much more proactive about thinking about pursuing blended finance, joint investments, and debt swaps. And I want to get something out of the way really quickly. This is not a hammer looking for nails. This is not thinking about engaging in these modalities because it's possible. it's thinking about engaging them, because we know that in a context where we see countries taking on more debt, in a context where we see real challenges of raising additional resources, contexts of where we see not as much alignment as we should see between development partners, really thinking about how we can consider making joint investments with partners and or consider our work around debt swaps is critical to programmatic impact. And it's really something that is now far more prominent in our new strategy for 2023-2028. Before I get into this, the word innovative finance can mean a lot of things to a lot of people. And I want to start by saying, what are the types of innovative finance that we are particularly focused on in the new strategy? And we're really encouraging countries to think about as they plan their funding requests. And there's really two. One is around what we call blended finance or joint financing. And this is really where we think about combining global fund grants with other sources of financing, primarily from, although maybe not exclusively, multilateral development banks and other development finance institutions. This can come in many forms. In some places, it's come in the form of what is referred to as a loan buy down, where the Global Fund makes the cost of borrowing money more attractive by working with a partner. Sometimes it's a pooled investment, and there's a variety of different modalities. But it is really an attempt to think about how we can maximize the use of our funding by combining it with another partner. And so that's one modality we've really prioritized in the strategy. And the second modality, and I have my colleague here, Blasis, who can answer questions about this, is our work around debt to health. And really, what our work on debt to health is an implementing country agrees to invest in programs to support the national responses to HIV, TB, and malaria, or specific investments in health systems through the Global Fund. And in return, a creditor actually cancels debt owned by the implementing country. And we've worked with a number of creditors, a couple major governments, to implement this in a variety of settings. And it's really an interesting way we can think about addressing challenges related to debt and also increasing investments in health systems. So those are the two main modalities we're thinking about for this next strategy and for the upcoming funding cycle. When we specifically talk about blended finance or joint investments, there's a lot of reasons we might consider these, and I wanted to lay out a few. There's a number of strategic reasons. This could be about gathering or crowding in additional resources for key pieces of our strategy. There are pretty significant expectations in our new strategy around how we're going to invest in resilient and sustainable systems for health. How are we going to fill funding gaps? How are we going to do more on pandemic preparedness? And yet we know we live in a resource-constrained environment. And so there are opportunities to work more closely with our partners to think about crowding in additional resources for things that will positively affect TB, HIV, malaria. There are also real strategic reasons around strengthening sustainability. Working with development partners who have longer timelines, who are perhaps better than us at working through government systems. And so we can work and address some of those tricky sustainability issues by considering joint investments. There's also a whole variety of operational reasons, right? Some of the development partners that we work with when we think about joint financing or blended finance have real strong experience, whether it's in-country presence or fiduciary and operational expertise, whether it's their ability to work closely with national institutions to strengthen data, evidence, know-how, or whether it's an example I think is particularly relevant, their ability to work at, say, a subnational level. The Global Fund is not always great at being able to interact at a subnational level, and some of our development partners and some of the institutions we could consider joint financing with are. And so there's a number of operational reasons, not limited to those, where we might consider this. And then there's a whole variety of programmatic reasons. A lot of the development partners where we would consider joint investments are already working on health systems investment, health system transformation. And working more closely with them provides us an opportunity to really address those. Let me use an example. We're working on a couple of joint investments right now where countries are looking about how we can deal with TB in the context of health system transformation. And one of our partners was already supporting the country as they think about reforming their health system and what that will mean for TB. And we're working on a joint investment where we'll mutually support that effort. In another place, we're considering looking at how migrant communities are linked into social health insurance schemes, where our partner was already making a very significant investment. And so rather than doing this on our own, we're thinking about potentially doing a joint investment with a partner. Because our partners in many ways might have comparative advantages, whether it comes to primary health care, PPR, pandemic preparedness and response, health systems, where making joint investments could be very beneficial to the ultimate people that we're trying to serve. And so I wanted to highlight a few examples because I think these investments are best seen through the lens of examples. And one of the places where we've done joint financing and blended financing investments in Laos, in that context, the country was really working on how it strengthened primary health care. And what it really meant to have an integrated approach to systems for health, including infectious diseases. And so rather than the Global Fund being able to work on this alone, we now have a joint investment with the World Bank and with others, where we're looking at more broadly integration with PHC at the community level. Another example of where this has been used was Central America with malaria elimination. In that context, the Global Fund had a small amount of funding to try to support malaria elimination, but the very tricky cross-border issues really required a much broader harmonized approach. And so there, the Global Fund worked with a regional development bank and other donors to harmonize our funds together around one common performance framework, so we could try to make malaria elimination at a more regional level a reality. In one context, in India, we've used these joint mechanisms to try to support significant additional investments in TB. As one of our most important TB countries, we worked on a loan buy down whereby we effectively reduced the cost of borrowing of the government so that they would make additional investments with loans into the TB, into the national TB response. In another country, in Pakistan, we've worked on a joint investment where one of our the World Bank was already working on a project related to primary health care. And by working with them, we were able to include some of the TB objectives that we really wanted to see in that project. So I mention those examples not because I would suggest that joint financing would always look like that, but because I think they're helpful in illustrating some of the strategic, operational, or programmatic rationales for why we would consider these. And we've made a big change in the funding requests this year, and we're really encouraging countries to talk to us and tell us about whether or not they would want to consider these types of joint investments in the funding requests. We're not requiring, of course, funding to be spent this way, but we are offering countries an opportunity to talk about whether or not there might be opportunities to do joint investments in the context of the funding requests. And this is really so we can take a more strategic approach looking across the portfolio of where there are opportunities. So you will see that in the funding requests in this cycle, there's a specific section where we ask applicants to describe specific arrangements or modalities related to innovative financing, what it might look like, who the partners would be, what the timelines might be. And that's really an opportunity, I think, to have a robust discussion about the national level of whether or not these joint investments might make sense and might maximize the impact of our use. We also know that these investments can come off cycle. That we're not always going to have perfect clarity around a joint investment at the beginning of the funding cycle. And so we always continue to look and are open to these joint investments, either through reprogramming of grants or through the Global Fund's use of portfolio optimization. But we are really focused on highlighting interest in this through the funding request for this cycle. So before I move to the final theme, a few key messages on this. One, I think early engagement, both with the CCM and by the CCM, about potential opportunities of how we could consider joint investments is quite critical. And by early engagement, I mean both early discussions with the country teams of the Global Fund about whether these might make sense, and quite frankly, more discussions with in-country development partners about what their projects are focused on and whether or not we should be considering in some way joint investment. Another key message, I think, is that while we really are focusing on making this more of a theme in country dialogue, opportunities can be scoped throughout the funding cycle. And so if we don't have perfect alignment around these opportunities when countries submit their initial requests, we should be keeping it updated. We should continue thinking about whether there are opportunities during implementation. The third is that we've used multiple sources of funding to fund some of these joint investments or innovative projects. We've had strategic initiative funding from the Secretariat. We've sometimes used partner funding, but I really do want to encourage countries to think about potentially using allocation funds or a part of allocation funds. And I'm not saying that because I'm saying that we should divert that funding from the more traditional grants the Global Fund has financed. I'm saying that though, because what our real question should be is how do we maximize the impact of funding? And how do we achieve those more strategic objectives? And we might be thinking about using part of our allocation funds to make a joint investment while some of our funding still sticks with more traditional Global Fund grants. So we really do think, as we think about 2023, 2025, that leveraging either debt to health mechanisms or joint investments can really be a critical complement to existing Global Fund grants. And we hope and we look forward to working with countries more on this moving forward. Before I pause for questions and answers, I just wanted to highlight one more thing quite quickly, which is around strengthening investments in health financing systems. One of the big changes that countries should see in this new funding cycle is that the Global Fund has updated our modular framework to include a new category on health financing systems. For those of you who are not familiar with the modular framework, I'm referring to the framework that essentially organizes how we spend Global Fund allocations. And as part of the RSSH, or the Resilient and Sustainable Systems for Health module, what we've done is we've added in a health financing systems category. And why I think this is so critical is because it offers countries much more clarity around potentially using some of our allocation funds to strengthen underlying health financing systems. This could be strengthening public financial management, which we know is a critical challenge in many countries. It could be enhancing the development and generation of health financing data or resource tracking, which we know is critical in many countries. It could be investing more in building sustainable mechanisms of financing communities and civil society, what many countries talk about or refer to as social contracting. It could be about financing technical assistance or planning at the national level to think about integration into pooled financing mechanisms, right? And so I offer it as a thought because as we think about how we use our allocation, we should be thinking not only about addressing the immediate needs, but dealing with some of these long-term sustainability and systems issues. And the updated modular framework now gives us much more clarity about where the Global Fund is encouraging that type of finance. So let me stop there. I know we've taken you on a very big tour, but I'm going to pause to see of different themes, quite broad themes. But I'm going to pause to see if there's any questions on specifically innovative finance or strengthening health financing systems. And I'm also going to use this as an opportunity to go back to any questions that the group might have. I also just did want to note, we have a couple of my colleagues here who lead our work on blended finance and debt to health. If they want to come in Enis or Benoit or Vlasis, just to highlight any themes I might have missed on that critical topic. But any questions?
Yes, we have one question that came from Nora. So we're gonna add it.
It's actually a great question, Nora, around if we have developed partnerships for this at the global level, how can we share that more robustly with countries so that they can know about how we're doing that? I think what you're referring to, and Enis or Benoit, feel free to come in if you would like, is we do have established partnerships, say with the World Bank, the Inter-American Development Bank in Latin America, where we've considered some of these. And so it's a very good point. I actually don't know how we've communicated that down to countries, but it's a great note, Nora, and we'll definitely take that into account to see if we can communicate that more robustly so countries know of the examples and know how we could use this. Benoit, why don't you come in? I see your hand up. Great. If you want to comment on that.
If I may, thanks Nora for the question, and thanks Matt for the overview of the innovative financing and especially the blended finance mechanism instruments. It's true, Nora. It's true that we are developing a sense of partnership at global level, and certainly developing together some modalities of joint work when it comes to the main multilateral development banks, and this is certainly the World Bank, the Inter-American Development Bank, the Islamic Development Bank, and soon the ADB. But it's true that we also, and that's the purpose of the discussion we have today, is certainly to sensitize the country level so that organically, because you work in partnership at the closest, between partners on the field, with partners on the field, we want you to be aware of this potentiality of these new instruments, in order that when you see that there is a project that is going to happen in the coming months and years with an MDB, you can bring, you can try to make the link and feedback to us that there is a potential opportunity for such joint investments. Ideally, I would say that it should come. There is a meeting point in the middle, but it can come from both direction and preferably from the country work. So yes, that's what I wanted to add. Thank you.
Great, thank you, Benoit. Enis, I saw you come on camera. Did you have a comment you wanted to add?
Yes,
on this topic?
Thank you. I think it was a very clear presentation. Congratulations.
Enis, just one thing, you might want to put your microphone down. A little hard to hear you.
Okay, I'm sorry. I hope you can hear me better now. What I was saying, that it was a great presentation, and I think the innovative finance plan, the finance section was very clear. I think one of the key things that we all have to be mindful of, given the fact that there will be challenges in raising domestic resources, I think it will be extremely important for the CCMs and people who are working with the Global Fund at the country level to actually reach out and at least be cognizant of what others are doing, mostly multilateral development banks, and constantly looking for opportunities to work together. And the same message we are also passing to our colleagues and partners at the multilateral development banks as well, so that they know they should go out and actually connect with the CCMs and others to find ways whether there is room for joint financing, whether it's a buy down or other mechanism going forward, because this is an area where eventually we will have to be building health systems while at the same time trying to eliminate the 3 diseases. So I think it is very important for all of us to be a bit innovative in doing innovative financing. Thanks so much.
Great. Thank you, Enis, and thank you, Benoit. Those are really helpful additions. So I'm going to come back to the questions we have on the screen and see how I can best address them. I know we're close to time, so some of you might have to leave. Thank you so much to everyone, but we're going to continue to go for a couple minutes to finish this well. Shufeng, I'm going to ask you to come back in on some of these questions around efficiency. I did have a question in there about, in summary, is the Global Fund open to innovative financing approaches, even if not totally articulated? And it's a great question, and the answer is yes. We recognize, we are really encouraging making this much more of a prominent discussion at the time of the funding request, for many reasons. To many of the reasons that Enis just mentioned. How do we strengthen the dialogue between the entities who are very prominently involved in the national TB, HIV, and malaria responses, and partners at the national level who are also funding complementary activities across the health system, and how do we bring those together? So we really do want to see more of a focus on this. At the same time, it's not, we don't have a crystal ball. We don't know exactly how this funding, the funding schedules will be. And so if it's not possible at the funding request, we are encouraging countries to stay open to it throughout implementation. One of the things that we've often said to countries is that if there's the potential to do this, why not include it in the PAR or the prioritized above allocation request? Whereas if we had additional resources, we would consider, say, X investment with a partner to achieve Y objectives. So there are opportunities to do this during this cycle, although we are encouraging people to focus on it more at the country dialogue stage. There's a question here. Let me go over to Shufeng. Do you want to take the question from Claude on diagnostic technology, Shufeng?
Yes, I just want to thank Claude to mention this, and it's a really important example of how we need to further strengthen the integrated planning of health system level investment. It could be the diagnostic technologies that also applies to human resources, training, supervision missions, supply chain systems, and our data systems. It will be a missed great opportunity of efficiency improvement at the system level. And I would encourage colleagues to look into our updated RSSH information note, which has been very, very clear about our suggestions around planning on the lab system. For the lab system in particular, we would like to encourage countries to rationalize the number of machines to be purchased and think through where they will be placed, what kind of services they would respond to. It definitely encourages a much more integrated approach. It's not only for HIV or TB, separately. It's for malaria, and ideally can be used for COVID and other diseases. And we also encourage countries to potentially carry out diagnostic network optimization analysis to think about the lab equipment in the context of improving the sample referral system as a whole for the investment of the lab system. Yeah, I cannot agree with you more, Claudia, on this part, on efficiency for system level investment. Very, very much important. Thank you for flagging. Over.
Thank you, Shufeng. To Theophil's question that I don't think we got to previously around what are the parameters that can be considered or used to increase co-financing in the country, or which factors can increase co-financing. I hope I'm understanding the question, but a couple thoughts. So first, the amount of co-financing we require based on our policy is linked to the income level. So generally speaking, in low-income countries, we ask for less, in the sense that when a country receives an allocation, the amount of additional financing that countries need to commit to either health systems or the national responses is a little bit less than at the middle income level. And so there is a distinction between income levels for obvious reasons, which is there is a progressive push for countries who are at higher income levels to contribute more to the co-financing of the national responses in health systems. There are some other reasons that countries could be more robust with countries when it comes to increasing co-financing. That could be around low prioritization of health overall, major funding gaps, specific areas where we see pretty large dependencies on the global funds for specific interventions, whether a country, when you look at similar countries or the region, isn't investing as much. So there's a whole variety of factors. That said, I do want to highlight that as we think about having these discussions with countries in the 2023-2025 cycle, I think what you're going to see is a much more nuanced conversation around not just the how much, but the what. Because we recognize two things. One, countries have been making commitments to co-financing for quite a while. And at the same time, countries are also facing quite a lot of financing challenges. So we need to really be thinking about the appropriate levels and amounts, and also the quality of those commitments, as well as are there opportunities to really be more efficient with existing resources and have that count as co-financing. And so we are going to really be thinking about that. That is not to suggest that the Global Fund is backing away in any way from co-financing, because we're not. It remains extremely critical for the success of the organization, for the success of the national responses to HIV, TB, and malaria, and for countries. But we want to have a robust, very nuanced conversation with countries about, based on their fiscal space, based on what they've been doing in the past, what's possible. And that would be a conversation about not just the how much, but also the what. I hope that helps Teofil. And I think I spoke to Roger's question a little bit ago, and it looks like we've addressed the vast majority of the questions. And I know we're at time. So unless someone has any additional burning questions, I think I'm going to close. And I'll go back, I think, to one of my original slides to just, I'll leave it here, to just say, first of all, thank you to everyone for joining. I know that this was a tour de force, so to speak, of many different themes, but I really would say that as we step back and we think about how we're going to achieve the programmatic impact that the strategy demands, that we know is important for the communities and people affected by HIV, TB, and malaria, how well we are able to use the co-financing policy to strengthen domestic financing, how well we're able to address sustainability and transition policy challenges, how well we're able to enhance the value for money of both grant resources and domestic resources, how well we're able to strengthen health financing systems and build long-term sustainable financing at the country level, and how well we're able to leverage more innovative mechanisms. All of these are going to be quite critical to the success of our ability to address the challenges and continue the progress in the fight against the 3 diseases. And so I hope that this stays as a prominent theme and feature for all of you as we go into the next funding cycle for 2023-2025. So thank you. Thank you to my colleagues from the Secretariat. Thank you to our Access to Funding and Communications colleagues. And thanks to all of you who were able to join and participate today. We hope it's been useful for you.